I wanted to talk a little bit about, and I'll do this just for a quick 5 to 10 minutes, about two things. One, the caretaker perspective, because that's been the role that I've played in this mental health world since I was a young child, growing up with a single mom with severe bipolar disorder, which is also known as manic depression, and also as a manager. And a business leader in being vocal about my personal contact with mental health issues. You can imagine that just makes you, a one-stop shop for people who may be suffering from mental health issues themselves or caring for others with mental health issues. And so I have become, very, I wouldn't say I'm an expert in any way, shape, or form, but very experienced in the caretaker role, both as serving as a caretaker while performing in a very high intensity field, as well as advising colleagues, staff, direct reports on how to manage their life and their career when they themselves are caretakers. We know the stats are that 1 in 5 Americans will suffer from a mental health crisis every year, which is pretty shocking in its own right. But that means, there's a very high likelihood that the other 4 are caretakers. And one of the things that we studied at Goldman, which, I give a lot of credit for being at the cutting edge of providing, mental health support for its professionals, even before the pandemic. One of the things that we did and we learned in some of our studies are that, like, people suffering from a mental health issue that Rachel highlighted, that they are sometimes your highest performers, caretakers are very often your highest performers. They are the type of people that want to take on responsibility, potentially because they were thrown into a situation where they had no choice but to take responsibility, and maybe they've received good feedback from that role at home or with a friend. And as such, they are the type of people that have, generally acted like owners and taken a large sense of responsibility for everything in their life. And so they tend to be people who take on a lot of work. We all know that the reward for good work is more work. Those tend to be people that, often get promoted and get more responsibility. And so they are often an organization's highest performers at all roles, at all levels of the firm. They just happen to be, very high, very often overachievers. But one thing that we learned that they're not good at is self-care. They really suffer from the ability to ask for help. They think they can do it all. They want to do it all, and then that does lead to burnout. And I've seen that, at all levels of the firm, from the most senior people, to people that are newer and entry level. The desire to be, always accountable and always on, without the ability to ask for help or know how to self-care, know how to set boundaries, as was discussed, is extremely dangerous. And that, what starts out as regular stress and anxiety can lead to severe depression and more severe diagnosed mental illnesses. So I think, one thing I want to leave everybody with is, it's important to take care of yourself. NAMI is heavily focused on self-care and taking care of the caretaker, and we have a lot of great courses and resources available for that. The other thing I wanted to share is lessons learned from my mother's experience, and specifically what's not on slides. What's not on these slides. What are the things that Jessica can't talk about, or Rachel can't put in a slide deck? Because a lot of what happens in mental health, because it is so stigmatized, is very hard to give guidance on. You're in the moment, you're dealing with an issue yourself. You're dealing with an acute issue for an employee or a colleague. You don't have time to find the slides that you saw 3 months ago. You don't have time to call somebody. You have to act quickly. What do you actually do? And a lot of my experience with my mom, as a child, number one, when, we were trying to get her, proper care and getting her hospitalized, and the hospital system wouldn't admit her many times because she was too smart to say she was a danger to herself or to others. Or when I was a little bit older and, trying to help her manage her career on things like whether she should, talk to her boss about the mental health issues she was facing, or should she not, because she wouldn't get the promotion, she wouldn't get the assignment, she would be stigmatized, she would be laughed at. A lot of that stuff happens, in the weeds. And so my first piece of advice to people is to just listen. It's truly to just listen. You don't have to solve problems. To give somebody outlet to talk, especially at work, is incredibly valuable in and of its own right. Okay. At the end of what do you have to say, after you've done your job listening, that's up to you in the specific situation, but you don't have to say anything more than thank you for sharing. Do you want me to take this to HR? I need to figure out if it's something that I need to take to HR to protect you. But I would like your opinion in that first. And I think that's all you have to do. And then you go and you think about, you call a NAMI, depending on that answer, you have certain paths that you can take. If they don't want you to go to HR, well, then you continue the dialogue with that person and understand why not, if you feel that you need to. And if they do want you to go to HR, you go to HR. If you're a little bit in the wilderness of not knowing what to do, that's why there are organizations like NAMI where you can call. And that's why, you can call Jessica, you can call people like us you can call your EAP on an anonymous basis to get advice on how to handle it. The resources do exist for people, to try to, find light while they're in the wilderness. So I think it's very important that you just listen to people. And if you happen to be a person that's suffering, like my mom was, it's critically important that you speak up. It was much harder 20, 30 years ago. It's much easier today. There are a number of protections that Jessica's gone through that will allow people to, that will protect you in your career path. But if your manager or your HR department doesn't know, and you can decide which is the path to go, isn't aware, it's very hard for them to make accommodations. And in very intense industries, people often do assume the worst, and they just may assume it's performance issue. They may assume you're not engaged. They may assume you don't like it there. And so you're doing yourself a disservice to not share what you're experiencing with your manager. And so I'm a big believer in transparency and communication, and I've seen that work in many more instances where I've seen it fail. And the worst case scenarios in mental health outcomes are when people don't talk to anybody about their issues, they don't get any assistance, and they just continue to go spiraling down the drain until sometimes it's too late and the worst outcomes occur, and sometimes it just leads to something that isn't as tragic as the end game, but leads to a very disruptive career implications and personal life implications. And so, there are a number of programs now that can teach people coping skills for how to deal with anxiety, how to deal with stress. There's a lot of resources available if you're dealing with something more severe to get free counseling, to find mental health care providers that are hopefully covered by your health insurance. But NAMI is terrific at directing you to places that are free and pro bono, and everything NAMI does is pro bono. So that's what I wanted to share, and I think at this stage I'll hand it back to Valerie and see what's next.
Yeah, no, thank you. I was gonna say, it almost feels trite to say thank you for sharing, but I think the reality is it's a multi-legged stool. There are legal lenses, mental health and public health lenses, and professional lenses and personal lenses to all of it. And what we really want to do is move the needle in terms of having a discussion. It's my understanding Jessica needs for CLE credit, those attending to CLE credit, to share a code. So before we go further, I'm going to ask her to do that.
Yeah. And I just want to, can you guys see the slides again? Because I keep unsharing and I keep resharing. But I think Nathan brought up some really important points just now that I want to make sure to touch on from a legal perspective as well. A couple being that for those who are caregivers or supporters or of somebody who has a mental health condition, there are also protections under the law for you. So specifically, and in the last couple of years, the local laws in particular have been continually updated and broadened to give more protections in the workplace. But caregiver status is a recognized protected class, for example, here in New York City. So that means that, and it's not just about you having children, it's also about you having regular ongoing responsibility to care for someone else who's a covered person, either a family member or someone who lives in your home. So it's very important to understand that you cannot be discriminated against for being a caregiver. There are also certain job protected types of leaves that you can take if you needed to as part of your support for caring for the serious health condition of a covered family member. And that includes under federal law, which is the FMLA, if you have at least 50 employees. in your organization within 75 miles. And then under New York's law, for example, the paid family leave law also kicks in. Both of them would provide you up to 12 weeks of job protected time off if you need to take time off to care for somebody covered under the statute. So really important developments. And the state law in New York, and there's other state laws as well around the country, even provides a partial pay benefit, which is another key advancement that we have.